And we are live broadcasting today. And I am Wes the Dental Guys, and welcome to this live broadcast of the Dental Guys.
And I'm John the Dental Guy, and we are here with really a special episode together today with one of our heroes for sure, Dr. Gary DeWood. And welcome, Gary. We're glad to have you.
Well, I'm honored to be here at all, you guys. Thanks for having me.
Well, let me give Gary, for those of you who don't know, maybe the little bit more official introduction, then we'll talk about kind of how we know him a little bit more personally. So Dr. Wood is the Executive Vice President of Spear Education, and he was for a long time involved in clinical education, starting back at Panky Times, and then one of the founding members of Spear, and involved in pretty much all of the curriculum direction and education, and now is doing even more with Spear Practice Solutions, which is helping practices to kind of take things to the next level through kind of the doctrine and the educational technique that Spear has. And we got to know Gary because we were fortunate enough to have him teaching in the facially generated treatment planning workshop that we took when we were kind of just newbies out at Spear, and really. I will never forget. I know Wes knows the story. I'll be very brief because we want to focus on what we're going to be talking about today. But I will never forget thinking what I was going to be taught the first day at the workshop, thinking it would be all clinical all the time. It would be heavy duty clinical. And in comes Gary, and he just says something along the lines of, "Why are you here? Why are you here?" And it was really about much more than the clinical. It was about determining where you want to end up. Why are you doing this? What do you want out of life? And I think that's a great way to kind of introduce what we're talking about today, because we're really at a point in our practices where we're kind of looking at more than just clinical dentistry. In fact, we're not looking at clinical dentistry so much. We're thinking about where are we now and where are we going to be? And there are some unknowns to that. So Gary, speak to that a little bit about, obviously you said you'd been in webinars all day yesterday. Everybody's asking the same questions, but we don't think it's a question that gets old. What do we do now? How are you talking to, how are you approaching that question of where are we now? Where are we going? What are you advising people to do at this point?
Well, actually, I think that what you want to do doesn't necessarily change at all because of something like this. In fact, I hope it becomes more clear to you. But the truth is, so many people, and thank you for noticing that, John, have never stopped to think about that. Most of us, and myself included, most of us, when we decided we wanted to do this, became involved in let's get busy getting busy. And what I mean by that is, school. How many elective choices did you have in dental school to pick where you wanted to go and what you wanted to do? There weren't any. You take all this stuff, you take it all, okay, and at the end of that, you're given a model and you go out and you say, okay, now I need to get busy getting busy. The two of you both figured out early on, and they said that they've spent some time with me. They have spent weeks and weeks and weeks at Spear Education over the years, and what's fun is, and I know you found yourself surrounded by people who have the same sorts of enthusiasm for learning and being together, which is one of the reasons I honestly believe you do something like this, because you get to spend time with people of a like mind, which is always fun. Anyway, I believe that it's that we often haven't taken the time, which is why in that setting, when I ask that, it seemed out of place, because everybody comes expecting clinical education. It's what we all seek. When someone asks a question that is different than that, it pulls us back. I'm going to argue that when the switch got flipped on practicing dentistry, and it kind of was a switch that moved around the country, and I'm pretty sure now it's almost to all states, although I think there are still some states where you can still make the decision to practice if you choose to. It's impossible not to think about it, because now it's like, oh my God, what am I going to do? I think one of the things that has made it possible probably for both of you to remain as you are and seem, which is upbeat and still gung-ho and enthusiastic, is because you had something else to devote your energy to. Because I know that when the switch got thrown where you are, and they said, okay, no more seeing patients except for emergencies, If you were like every other dentist in the world, you said, okay, so what's an emergency? Let me define that for myself first. And then the ADA helped with that a little bit. But the truth is they left it open enough that you can decide on a patient by patient basis what an emergency is. And I think that's the wonderful part about being doctors. In some states, that's not true. In some states, we've been pretty much told don't practice. In Pennsylvania, which is interesting, if you've heard or seen any of the things out of Pennsylvania put out an edict, a mandate that only dental emergency patients could be seen. They could only be seen in facilities, and they listed all the criteria. One of those was where you had done proper training about how to don and doff an N95 approved mask or a PPE. I'm sorry, not mask, a PPE. You have to work with goggles or face shields. You have to work in an environment which is negative pressure, which means that if you work in an environment where air can go out of there, you're not allowed to see patients at all. It effectively, I think, shut down every dental practice in the state, because I don't know of any dental practices that maintain a negative pressure operatory. My point in this is all of us have been forced or are going to be forced or are now being forced to make the decision about, okay, good Lord, why am I doing this? And what's been fun for me in all of this is to see that the reaction from most people is not, I wish I hadn't done this. It's what can I do to help us get through this? And I got to get ready for my patients because they're coming back. And when they come back, they're going to have missed me. What am I going to do with my hygiene schedule? Because what happens when you take 2 months worth of hygiene and you try to move it forward? That means you're going 8 months out, right? Just to start filling those. So the people who are coming in 6 months, you're not going to be able to see them back in 8 months, which means that one of the things you have to do and be thinking about right now, because I'd rather be thinking about what's going to happen when I'm back to work, is what are we going to do with the people who now want to come and spend time with us? We're going to have some creative scheduling. We might be doing some 6-day weeks for a while. I mean, and I'm not talking about capturing revenue. I'm talking about getting ourselves back on track with patients who depend on us on an ongoing basis to be able and be there for them for those purposes. And I think creative scheduling is going to be something you have to think about. I think the most important thing is this. Finding out that you can't go do this. And I'm going to bet that everybody who's listening right now had that thing that happened in the pit of their stomach. Didn't you have it? I had it. I mean, when I realized this was not going to be something that was going to be a normal outbreak, when we can manage it by, we got to not be with each other. I mean, you can see that I'm coming to you I'm social distancing. I'm on the surface of the moon. You can see the earth behind me. For those of you who don't know, that's actually a digital backdrop, because if I move my head fast, it tries to wipe it out. You can probably see that. Anyway, we all have learned to not be with each other for right now, okay? There's that thing that happens in your stomach when, oh my God, what's going to happen? What am I going to do now? What's going to happen to my family? What's going to happen to my team? All those things come into your stomach right away. Here's how I'm very visual, and in my head, I realized all of a sudden, in often a few moments' time, I find myself standing on the edge of a giant cliff with a whole thing out there that somehow I have to defeat. The only move forward that I can see is to jump off the cliff. And I would argue this. I'll go back to something I read a long time ago by Sir Edmund Hillary. And they said to him, if you remember, he was the first guy who summited Everest. There was no oxygen masks. I mean, there was none of this stuff to take along. He couldn't take all that stuff with him in enough to go that whole distance. And somebody said to him, how could you looked up at that mountain. How did you even think I could ever get there? And he said, I never looked at the mountain. I looked 9 inches ahead and I took one step. And when I made that step, I looked 9 inches more. And I said, can I make that step? So here's what I would offer and what I've been trying to pass along to people, because I am afraid. Okay. I'm owning it. I have fear about what's going to happen because I don't know. However, that fear doesn't mean that I can't do something. If you find yourself at a brink where you're saying, when you're in panic mode, the thing to do is immediately stop and find something you can do. Answer some questions you can answer. Take one step back and look 9 inches ahead and say, can I step that 9 inches? So I'll give you some quick examples of that we've been working with clients with, directly for the past week. is number one is when somebody gets a hold of me and says, I don't know what I'm going to do, how am I going to pay my team? And I say, well, let's do this first. Number one, let's assess the true situation right now. What are your financial resources you have on hand immediately? What is liquid that you can go get somewhere if you need to have it? Okay. And what you do is you build a picture of that. Then you say, what things do I have to spend money on? And while this can be seen as essentially self-serving because of what I do now, I think that at this point in time, your best investments are in learning and advisory people. I mean, seriously, I told somebody the other day, I said, you're a client. If we can't be more valuable to you right now than ever before, and probably never again, then you probably shouldn't have signed up in the first place. Right now is when this is what you should be buying. What return are you getting on your dental practice right now? Mm-hmm. Zero. What return are you getting on your rent for the facility? Nothing. Okay. Now I'll ask it this way, and it sounds awful. If there's team members listening, listen to the whole thing. What return are you getting immediately on your team is a great question to ask yourself. And if your response is none, then I would argue you haven't thought through what is possible in this situation. Because I think this is a time when you can pick, how can I engage my team? One of the nice things about this right now is that in many jurisdictions, many states, the unemployment rules have been changed so you can furlough people to a kind of a part-time basis and allow them to collect unemployment based on the other. For instance, if you could use somebody 20% of the time, 2 days a week, they could work from home. But, somebody said they can have access to your patient database. They're on your team. They're an employee. They already have that access. They could be getting a hold of patients and talking to patients just to make contact. How are you? Is everything okay? We're looking at moving forward. We don't know yet what's going to happen. We're going to be getting back with you. I mean, those kinds of things can be incredibly useful. What if you could do that 2 days a week and 3 days a week? They could collect 60% of an unemployment benefit. See, I think if everybody would back up right now and see where you're at financially, it'll give you a clear picture. Now, the clear picture may not always help you. Let's be honest. I talked to several young dentists who don't have the cash flow to be able to cash flow any of those kinds of things right now. And so, I mean, one of the things that we have to do, though, is here's what I discovered in my life. When I get in times when I am totally panicked, I don't know what to do, and I'm afraid, the best thing I can do is take a deep breath, step back, ask myself this: am I in any immediate danger in the next minutes, hours, days, however you want to phrase that? And if the answer to that is, well, no, I'm okay for a day. For today, I'm okay. There's nothing that has to happen today that if it doesn't happen, it's over for me. And then let's assess what the situation is. And financially, we got to assess it. From a patient standpoint, we got to assess it. Okay. And don't make plans to move forward until you assess exactly where you are. And if you get to the point where you say, there's not enough money here to pay my team, you can do what a young dentist that I know in Washington did. She met with her 3 team members and she said, I don't have the cash flow to be able to pay you your regular salaries. I spent all night, I spent a lot of time. She spent hours on the website at the state. And I found out that you guys can file for unemployment. There is no waiting period. At least you'll have something that will help with your expenses. And while I don't have a lot of money, I do have some savings. And if there's something that you can't not do, call me. I'll do anything I can to make sure we all get through this okay. Mm-hmm. I think if you say something like that, you have figured out a path forward. And more things are coming available. I mean, the whole 12-week leave thing, which is interesting. If you're able to help people with paid time off and get them through a couple of weeks, there's 12 weeks of paid leave that if you could find a way to finance that. And have you read that or seen that thing?
Yeah.
Okay.
Yeah.
So I'm sure you have. I'm sure it's come up a ton. If you could find a way to finance that, it's 100% reimbursable.
Right.
Because it's a tax credit, not a deduction, a credit, which means if you got to the end of the year and you owed $100,000 in taxes and you had spent $50,000 doing that, you only owe $50,000 in tax. That's 100% reimbursable. I think that's worth thinking about. Is there a way for me to manage that? I don't yet know what the rules are going to be. They promised us clarifications. What if I want to use somebody part of the time? But I'm going to argue this. If we made that arrangement for people to make it able for them to get through, I'll bet you a lot of your team would be able to volunteer time to talk to your patients because they care about them too. And I don't know about you guys, but what I discovered is in any kind of an emergency time, I go nuts if I can't find something I got to do. I got to do something.
Yep.
Most dentists are like us, I would argue, and they freak because we all freak. And then we want to do something. That's standing on the cliff. I don't know what to do. The only thing I have to do is jump off the cliff. Now, back up. Let's back up. Say, what could you do? And do whatever you can do. And then sometime take some time off in the day and get your brain away from that. Sometimes the best things you can do. My Peloton has become a good friend. I've been on it twice a day some of the days, just to go in there, just so I have something else coming into my ears. And that lady or that guy on there, he ain't talking about this.
Right. It's a virus-free zone.
Yeah, actually, I saw a great thing somebody sent me yesterday. You might have seen this one. It said, "Dear God, can we please deinstall 2020? It has a virus."
That's perfect. But yes, great. You have to have a way to withdraw. I mean, it's a combination, as you say, Gary, of being able to be proactive to give us a focus, but also you have to be able to withdraw and do something that just gets you somewhere else, puts you somewhere else for a little while. And today, I mean, there's some real positive things that are coming out in what's happening with this new bill. And of course, there's a lot. I mean, every CPA, every CFP, every consultant, everybody is scrambling to figure out exactly what it's going to mean. But it sure sounds like anything that it's going to mean is going to be positive. And I think is going to help us to get through this. And potentially, as you said, I mean, having things that could be reimbursed from a tax standpoint, maybe even having loans that are forgivable. Some of these things are just huge. I mean, unprecedented and all helpful to keep our teams. I mean, and our teams, the cool thing about some of this stuff is our teams may not necessarily know the tax implications. They don't necessarily understand, but being able to say to your team, "Hey, guys, I found a way that I can pay you for 12 weeks at your whatever pay rate is you figure out."
I think you can give them up to $200 a day, half of what they would normally earn, up to $200 a day.
Yeah.
But remember, this came up in a discussion, and somebody said, well, yeah, but I had $200 a day. And I said, now don't forget, there's no taxes taken out of that. And this is what's really wild. Included in that same bill is if you're on a plan where you're paying their health insurance and they're making a contribution, you're allowed to make their contribution and get a tax credit for that as well. So you can pay their health insurance and have that 100% tax credit to you. I mean, there's some neat things in there that are making it possible for those who can. Yeah. The difficulty is that if you're a young practitioner, if you're out, I'm going to say 7 to 10 years or less, 0 to 10 years or less, what you've been doing over that time is finding a steady flow so you can be paying off debt. I get this, which means you probably don't have the cash flow to be able to do that 100%. And that's where it becomes more difficult. That's why sitting down to say, what kinds of things do I have available right now that I could do? Mm-hmm. You've been funding a 401k, sometimes it's possible for you to take loans against your own 401k and pay yourself the interest. I mean, there are some things that you can do. And I'm not a tax advisor. I'm just having people throw ideas to me that they're hearing from people. And I have talked to advisors in Washington and in Ohio a lot to try and figure out all the new rules and what we have to do. But I'm not a tax advisor, but I agree 100%. Your team is even less that. Mm-hmm. And I think they want to hear from you that you're thinking of them, because I know you are. Yep. We're all worried about what's going to happen with this, and owning that is okay. And then you tell them that it's okay to worry about it. And they say, here's what I've been doing. And then encourage them to find something that they can do. One of the fun things for me that was most hilarious yesterday, and I was with a group, was that somebody said, well, I have definitely learned, I've been getting my mind off this because my kids are home from school and they started doing teleschool. Mm-hmm. And it's expected that if your parents are home, they are participating. It was wild.
Hmm.
He said, I've learned that I'm sure glad I don't homeschool my kids.
Yeah. There's gonna be some people that are very thankful because this may be the end of the school year for a lot of students. I mean,
I think for tons of them, it's going to be it.
Yeah. Yeah. So it's going to be a getting to know your kids again type of experience over the next couple of months, and your spouse or significant other. But yeah. But I think that this is the chance for, like you say, for maybe new ideas and new ways of thinking about things, and that deep thinking that we don't a lot of times get a chance to do because we are in that hamster wheel. But I want to go back to what you said earlier, Gary, about advisors, because we couldn't agree with you more. We've been talking nonstop to people as well, been texting us, sending us messages saying, and almost always the question is, what are you guys doing? And it's kind of disturbing. And I mean, it's nice, don't get me wrong, that people are asking, but I get the feeling that everybody's just in maybe Facebook groups or text messaging groups, and they're just trying to ask, well, what's my buddy doing?
Yeah, John, we talked about this the other day. I mean, like, I feel a little bit concerned that we're calling our friends for advice on issues like, complex tax issues are, not for me. I mean, I cut teeth and do treatment planning. And so, if you are in this boat, Dr. DeWood, where you maybe don't have, someone, who do we go out and get immediately, to help
as
us?
Crazy as this sounds, okay, I'm going to bet that everybody has an accountant. Because I doubt that I don't know of any dentist who's doing their own taxes unless they have an accounting degree and like doing that. It's usually more work than you want to do. And so that advisor you probably have a lawyer, and calling the lawyer is probably less at this time. The accountant they're going to ones that are going to have to figure out how these rules work on that other stuff. And the one that I think of is that that's when being in a group can be helpful. In other words, if I'm in with a group of my friends and they're sharing with me things they've learned, and it's not something I can apply myself, if they've learned it from their professional, I think then that does become the natural place where that comes out. Actually, I'll tell you a quick story that I found really interesting, because it came up in a group day before yesterday with 2 study clubs. And the study clubs have, their renewal was like when this all hit the fan. And the club got together and decided to renew. And the primary reason they renewed was they came to us and they said, are there any rules about how often we're allowed to set up a meeting? No. We've decided we're going to meet every day. and some of it'll be dental content. Most of it won't. Most of it'll just be, what are you guys doing?
Yep.
And I thought it was really cool that it was a neat acknowledgement for me that I hadn't thought of before, of the need to do something together with other people probably on a daily basis, so that you don't feel shut away from the world.
Mm-hmm.
Mm-hmm. I can't sit and listen to this stuff I can't watch the coronavirus saga all day on the news. Mm-hmm. I mean, that's not doing anything for me. It's too much information. Not that I don't want information, don't get me wrong. What I've been doing, though, for what it's worth, if any of your listeners, and you guys might want to write this one down, there's a great YouTube channel called MedCram, MEDCRAM, which is incredible. It's this physician who's doing something every day. It's from 6 to like 15, 18 minutes of the longest ones. And he covers a different thing each day as it evolves. It's really excellent. I recommend it highly. I've been trying to find times, anytime in the 15-minute breaks in between some of the webinars yesterday, I was gone to that site and some other sites and just kind of watching what's current. Because for me, that's a way for me to pull my mind away from the immediate when I can't do anything anyway and just try to learn about it. I've also had a couple opportunities to spend some time with a couple of groups, and study club ones mostly, and do some dental stuff, because one of the things I've noticed about dentists, I know you guys are like this, when times are bad, you pull back. And one of my mentors told me a long time ago, what's going to happen when you get to crisis is you're going to want to go in the back and prep teeth, because it's going to make you feel better, because it's what you do.
Sure.
And he was so right. And so what I've noticed is that with a lot of dentists, once we all of a sudden become aware of what's really happening, one of the best things you can do is find some time to go back to what you love and sit in on some of the stuff. So we've been doing clinical and non-clinical discussions. We're online every day from 11 to 12 this is Phoenix time, 11 to 12 with our clients with the SPS group. And then from 1 to 2 Phoenix time for anybody who has a subscription, anybody who's in our world can come. And we've been doing dental things on both of those a little bit to try and get people back to the fact that we're going to go back to work. Mm-hmm. One of the lights at the end of this tunnel is that there is a light at the end of this tunnel. We know what's going to happen.
Yep.
What we don't know is how we're going to be able to cope with what's going to happen. Because the truth is somewhere between 1.5 and 3.5% of the people who contract this virus are going to die. Okay. That's horrible, but we know it. I mean, we know it's going to happen. We realize that it might go up based on our ability to cope with people who have the more serious part of the disease. But even if this spiked immediately, okay, and it was the worst possible, and let's say 8% of the people who contract it died. My point is not to say that's okay. Here's my point. We know there's an end to this. Mm-hmm. It's going to happen. It may be sped up by our ability to treat or to vaccinate against. I think one of the most promising things, and Dr. Glick was pointing this out last night, right now when they're doing testing, all they're testing for is virus, which means that say you've already had the virus, because there are plenty of people who probably have this and never had symptoms that made them go any further. One of the things that we're going to probably begin doing before too awful long is checking for the immunoglobulins, the IgMs and IgGs. IgMs mean that you have probably just beat it, and IgGs means you have onboard stuff. Some preliminary studies are showing that, and I got this from Dr. Glick last night, that probably it looks like one of those viruses that once you get it and you get the antibodies to it, you're immune. So one of the things that he's in a group that they're talking about is as soon as those tests are viable, it would be possible for you to take the test, find out if you have the IgGs. If you do, you're immune. Mm-hmm. You can work without any different kinds of protection, work with standard protection because you're not going to get that virus again. If we could figure that out, that totally changes what happens moving forward because now immune people can go do stuff.
Sure.
I have to still be careful about carrying it to somebody inadvertently, but that would be like, touch and all that stuff. And if I wore a mask to make sure that I hadn't just got some in, you get my point here?
Yeah, right.
It would drastically change that curve. We don't know that stuff. We don't know what's going to happen to make the curve bring the end of the tunnel sooner. We don't know that. Mm-hmm. But we know there's an end to this tunnel. And it could be horrible in the middle, but there's an end to this. Someday we're going to be doing dentistry again. I'm in the at-risk population, so I may not be here.
Right.
And even if you're not in the at-risk population, you may not be here either.
Right.
But we know that at the end of that tunnel, dentistry is going to come out, and most of the people who are doing dentistry before this occurred are going to be doing it again after.
Let's talk about that.
That's not said to settle you down or make you calm.
Yeah. Let's talk about that. Let's talk about ramping back up.
Okay. What's the biggest problem you're going to encounter the day you open your office?
The biggest problem, because I can think of several problems.
Well, the biggest problem is we just donated all of our.
You don't have to scale them then. Okay, so pick one. What problems are you going to encounter when you go to the office?
Probably PPE equipment. Right? Is we just donated all of ours. Right. So when are we going to get that?
Yep.
Okay, that's if we got because you got to have that to practice.
You have to have that to practice. What kind you have to practice will be interesting to follow up with. Mm-hmm. Because if there was a way that if more people found out that they've already had the virus and you're working with a group of people who are immune to the virus, you can use a surgical mask. Who cares?
Right.
Then you're back to the normal things we do. The other thing in that is that I think a whole lot of people are finding out they did have N95 masks in their practice without even knowing that's what they had. I've been getting some notes from people who said they've been went back and were digging through their stuff and realizing those were N95 masks. Okay, so you go and you look and you see what you have. And then you decide, how do we manage that? I think there's going to be some pretty creative things coming out. I've been bouncing around because it's what I do when I'm not doing this and looking around at stuff. You can go and get, if you have a 3D printer, you can get the program to build a little filter. And what it has is a little thing in the front with a snapped out thing where you can cut out a piece of N95, snap it in and put it in. Mm-hmm. It's a hard material, so it is cleanable in the middle of that with alcohol or anything that you choose. It looks like alcohol is the thing that does this virus in the easiest, based on what I've been reading. There's going to be some things that are going to come around that are going to probably make it possible for us to get back pretty quickly. And then sometime the curve of creating those things is going to catch up, and we're going to have way too many of them, and they're going to be really cheap for a while.
Yeah, exactly. Exactly. It's going to be a problem once the vaccine hits or whatever.
I think then people are just going to have to reorient their manufacturing. My point is, I don't know when that'll occur from the time we're done, but you're going to be able to get them pretty easily at some point following. It will be an initial concern and something that we have to be very aware of. Yes, I agree. But I also think that ramping up production, it sounds like, if you believe the news, is something that they can do pretty readily.
Yeah. So. Yeah, I think by the time we start seeing other countries recovering from it, there'll be that wave where there'll be countries that, like China, hopefully will able to increase its production as people are going back to work. And by the time we're, through it on our side, we'll be able to go back. I guess my biggest concerns just relate to two things, which you kind of alluded to before, which is scheduling and capacity.
I
think that's my number one. And then second would be, demand for services and patients that are going to be financially more nervous. Whether or not they have the money, I don't know, is going to be the concern as much as it's going to be a sense of anxiety potentially that may be there about spending it. I don't know. Those are maybe my two that I'm not sure what to exactly do with.
So obviously in this, I have opinions, but I have no facts to deal with here. This is totally opinion, totally guess. So I'll tell you what I think based on that second one, which is people with financial concerns. It'll be interesting to see how this plays out, because I have lived through things that were financial concerns and things that weren't. I'm old enough to remember when HIV made its appearance. It impacted dental practices dramatically because it was a virus of people you couldn't tell if you had it for a long time. You didn't get sick right away. I mean, all those things happened, and it passed quickly. People were afraid to come to the dentist. There were concerns about, spending any time in a chair. It passed pretty quickly because as things became available, we realized that what had actually changed was not anything except that specific thing. It was different in 2008. Okay. And I'm old enough to remember the crash of 87 too. So in all of I'll use 08 because probably most of us on here have some memory of that time. There was a slow but dramatic and change over time, but it was slow. Okay, that was because that was about true financial concerns. I don't know if I'm ever going to be able to recover from this. I have a feeling that same sort of feeling won't be as evident after this, because it wasn't a financial issue when it happened. To me, right. This is more like war. Yeah. Do you go into debt during wartime? Does your stock values drop? Most of them do. Some of them go up because they're building stuff and the government's going to make sure they have money. But I think what we're experiencing now is way more like a war. My experience with war is nothing like my ancestors who lived through that sounds bad, all wars are real, who lived through wars that encompassed the entire globe. Everybody on the planet was involved. We haven't had wars like that since.
Right.
The wars that I'm experienced with in my lifetime, and my youngest one is Vietnam because I was eligible for that, had a draft number. Fortunately, it was like 326 or something, and they never called me. That kind of war is different than one in which the whole globe is totally engulfed. This is that kind of war. I mean, this is, and what happens after those wars, in my experience, is that you see rebuilding that occurs much differently. People want to get back to doing things that were normal because we did something, we defeated something. So I don't know this, and maybe I'm naive and an optimist, and there might be economists out there saying he's out of his mind, but I just can't believe that people won't want to get back to doing things that are normal again pretty quickly once we set this thing behind us. And then the fun thing will be the conversation for me that's going to be different going forward is, how does it change any infection controls? What did we learn? Mm-hmm. Okay, what could we change that makes perfect sense for us? And how would we be able to turn something like this off much more quickly should it occur again? Because it will.
Right.
If the planet becomes more dense, it's impossible for it not to happen again. We just don't know when.
Yep. Yeah, and I agree. I think that's a question, but I think it's most people, I believe, are in your camp of believing that the stock market's going to come back pretty quickly and the economy is going to recover most likely pretty quickly. And I think that we are seen as a necessary service if we've done a good job in our practices of teaching our patients, educating our patients. And I think that's another thing we can be focusing on during this time, is trying to keep connecting with our patients. And what are your thoughts on that? I'd like you to hear what your thoughts would be on how do we keep that connection for that need to our patients during the time when we're maybe away from the office.
Okay, so we are making some specific recommendations around that, which is why it can be really useful to keep people, some of your team, involved on at least a part-time basis. We're recommending that somebody is always answering your phone. And, I don't know, most people that I know are doing it, are giving a phone number you can call 24/7. Just call that number. Somebody will answer that phone. And what they're doing is they send out a contact, some sort of an email, and telling people what's going on and telling them they're there. Because when people hear all this news, it goes out on the news that any non-essentials you can't do those, only emergency things. People leave dentistry on the side often and say, well, then dentistry's shut down because nothing we do is emergency. So I would send something to patients that said that, we are following the recommendations made by the American Dental Association and or whatever state you're in, or however you want to say it. So our office will not be seeing non-emergency patients. All right. We are, however, available at all times for emergencies for any of our patients. And then you could go further, in my opinion, and you could say, and any one of your friends who needs care and is unable to find a place to go. Okay. So, and my point in this is this. Then you say something about, if you feel you have an emergency issue, please contact this number. We will be sending out updates every however many days, and I maybe once a week. So you tell them you're going to connect with them once a week or every 3 days and tell them what's going on, so that when it's appropriate for us to begin seeing all of our highly valued patients like you will know that we are open again on regular hours, whatever you want to say it. I think if you do something like that, you set the stage for that you're going to come back again and contact them again. Okay. And so they're expecting something to come from you, and you can keep people posted on stuff. And then, of course, anybody who has an appointment, how are you going to not contact those people? I think we have to, even though they assume they're not coming, we're still going to get a hold of them, even if I don't know where to schedule them.
Right.
I'm going to touch base and I'm going to say, I want you to know that we are keeping a full list of all this. We will be contacting you immediately following. I know somebody in New York who had signed up for one of those things where you can go online and pick your own appointment. Mm. Okay. And what they told them was, as soon as we know when we can see patients again, we will be updating our schedule. We will alert you through an email alert or a text or text, whatever you have selected as best for us to contact you, so that you can go online and pick a time when you can come in for your regularly scheduled hygiene therapy visit or whatever it is. If you would prefer, as soon as you receive notice that that's available, please call Shelley. Shelley will be happy to place you in one of the available appointment times. Something. If you do something on an ongoing basis, you stay in people's minds and they know that you're still their dentist. Find something you can do that will connect with those patients. Now, the other part of that is you're going to have a capacity discussion, and you brought that up. If you want to get people back in the flow, you're going to have to figure out, how do I do this? And one of the things that I've been talking about is, if you have capacity to add hygiene time because you have a chair available, then you think about that. Okay, maybe you have hygienists who work some different days. You could move them. Can you work more days? Now you have a discussion. What's more valuable to you? Is keeping a patient on a regular schedule and paying some overtime, or finding temporary part-time people to come in so that you can pay them a salary that is closer to what you would pay your own hygienist, rather than having time and a half with hygiene, because that often makes it economically less feasible. However, in the long term, that might be an excellent investment to get people back on a routine.
Yep.
And when you have to see what you have to balance and compare that. In some practices where you can have general supervision, maybe what you could do is find a time when your patients can see a hygienist when you're not there, but you weren't doing that previously. And then you might have to find somebody, but your own hygienist might be willing to do that. Now that would be, to me, that's a highly valuable thing to think about doing. All kinds of options are available when you sit down and start brainstorming them.
Well, I think
when you sit down and just say, go ahead, Wes.
Well, what I think all this is built around is communication and good communication skills. And these things that you bring up definitely work, because we employed them immediately and got a response from patients like that, was like, well, I'm just so glad you're letting me know that I have a place to call. We sent out an email.
Thank you for saying that.
Right.
Dentists out there need to hear that your patients will value your contact now more than ever before.
Yeah, they do. And we're trying to do some video stuff on our our Facebook feed, for instance, just some little tips on how they can avoid having problems during the time that we're out. Trying to engage our team to help with that, to where they see our faces, they see that we care. We're not making any money. That's the whole point. Is it's not about that. It's about just keeping top of mind, showing that you care. And we're getting tremendous response.
My wife's a dental hygienist. She brought up the fact that, hey, think about all these patients that are on 3-month recall right now in our system. And we have a slew of them. And she was like, one of the things that she's working on behind the scenes is how to reduce bacterial load in your mouth for periodontal patients. And so we're going to do a little live stream on that maybe this week and talk to our perio patients, and then put it out in email too.
One of my friends, I dug up this article. We were just talking, but it was an article. It's a recent article out of China. And so it's some of the patients who are these patients. And they found a correlation between severe periodontal disease and cardiovascular events in these patients.
Interesting.
In other words, more severe. So one of the things I said you know what you should do? You should write about this, have the article as an attachment for anybody who really wants to read it, but just sum up what you heard on there and say, change your toothbrush. Okay, this time it's more probably, if you contract the virus, it may be more important than ever for you to keep your mouth as clean as possible, which is what you're saying, Wes. Find a reason to tell them that, excuse me, and then just find a way to make it possible. One of the things that this person did, this person does not have thousands of patients. This person has like 700 patients. And said, if you need a toothbrush, tell me how many people are in your house. I've been hoarding them for years. And was making a joke about the toilet paper. Said, I don't have any toilet paper I can get you, but I have been hoarding toothbrushes for years. If you need a new toothbrush, tell me how many people are in your house, and I will ship them to you.
That's awesome.
That is you could do that for 500 people. So I did follow up. He had 247 people who got a hold of him, and they sent him toothbrushes. They paid a delivery service because the delivery services are still working. So it wasn't like you had to do FedEx. The people who are delivering food are just as happy to deliver a package. It's just pretty wild. There's been some places that are set up that you can move stuff around in town pretty easily. And anyway, excuse me, I got a glass of water, and it's about time anyway.
It is about time to shut her down.
Yeah. Yeah.
It flew, man. It really flew.
It did.
Well, I just want to say, first off, Gary, thanks for what you're doing by, staying engaged with the dental community through this, like you guys are, and you always have been that way. What are some, just before we kind of finish out here, what are some resources that through Spear, that people who maybe are connected with Spear, or people that currently aren't maybe connected with Spear, where can they find out about what you guys are doing?
Well, if you're connected with Spear, you probably have been getting our unending contacts. I mean, we're awful about calling you all the time with an email, not calling, but sending you notes and emails, because we have so many different groups in there that want to connect with all of you guys, that all of us send stuff. And we had to back off on some of that. So if you're already part of Spear, I know you've already gotten this stuff, and we're on at 1 o'clock every day, our time. So whatever time zone you're in, we are the same as California now. So Eastern Standard is always 3 hours later than where we are. We're on there. Spear Online, which is interesting, in the past 30 days, we have seen a significant increase in new subscribers relative to the previous 30 days. I got to tell you what that tells me about dentists and dentistry. When the crisis happens, dentists go somewhere where they can learn. And it's why I said learning is so important. If you're not associated with Spear, we still have many things available. Okay. If you go to our site, there's stuff available. And I am personally happy to do anything that I can to do whatever I can. And you can get my information. If you go to our website, you can find how to email Spear and ask to connect with me. And I'll try to connect you with any sources that I know of relative to just what you're looking for.
Awesome.
I know that if we stick together, we can get through this thing.
We're definitely going to get through it. Yeah.
Yeah, we're such strong believers in that. That's why, like you say, we're doing what we're doing, because we believe that through this time, we can just get better and come out of this in a more positive and strong way. And I think that the connections that we're having are showing us how important camaraderie is, and I'm seeing some good things happening, through that. So for those of you who've been watching this, if you've enjoyed this conversation, if you like what Gary's saying, connect with him at Spear Education. Go to speareducation.com. We've got some links in the show notes to that as well. And make sure that you are staying connected with your team, with your patients, with your profession, with Spear. Whatever you choose is a way to continue to learn and make the most of this time. And make sure you connect with us as well on all the socials. Facebook, YouTube, Twitter, Instagram. We're on all of them, as is Spear. And so make sure you let us know what you thought about this. And thank you again, Gary, for being with us. For Wes, I'm John. We are the Dental Guys.
That was fun. Thanks, guys.
Yes.
I appreciate it a lot.
Thanks John and Wes,
I look forward to, I appreciate what you guys are doing. So don't underestimate it. I mean, the more of it's really cool what I've been hearing.